Good morning, everyone. I'm Hui Shi, dietitian from National Healthcare Group Polyclinics. Today, I'll be sharing on sustaining food habits. In my 10 minutes talk, I will be sharing about what to eat, when to eat, and how to eat. I'll also explain some of the pros and cons of the popular diets. What to eat? In our diet, macronutrients are the nutrients we need in large quantities. The three primary macronutrients are carbohydrates, protein, and fat. Carbohydrates makes up 45 to 65% in our diet, while protein and fats makes up 10 to 35% and 20 to 35% respectively. Carbohydrates fuel our body with immediate energy. Protein provides amino acids, which are essential for building muscles, skin, blood, and important structures of the brain and nervous system. And fat is vital for brain development, insulation, energy reserve, cell function, and protection of your organs. All are equally important to our body. This should be a familiar diagram to all of you. If not, I would like to use this opportunity to introduce this healthy plate concept developed by Singapore Health Promotion Board. My healthy plate is an easy to understand visual guide. It helps you adopt healthier eating habits, which in turn can help you better manage your weight and ward off chronic diseases. Quarter half is an easy way to remember the right proportion of each food groups in a well-balanced diet. Here's how. Few quarter plate with whole grains. Few quarter plate with good sources of protein by choosing lean meat and using healthier cooking methods. Few half plate with fruits and vegetables. Aim 2 servings of fruits and vegetables each daily. And this is how 2 servings of fruits and vegetables looks like. Reduce intake of sweetened beverage. Choose plain water. Choose healthier oil instead of saturated or trans fat. Lastly, aim for 150 minutes of exercise, moderate intensity exercise per week. When to eat? A common misconception that people often have is to skip meals to lose weight. Those who have journeyed through will share their experience that skipping meals are not guarantee weight loss and is also not healthy nor sustainable. For those with diabetes, especially if on medication, eating at regular intervals is important to keep your blood sugars consistent and for your intestine to optimally digest and absorb nutrients. Setting a consistent schedule across the day can also help to avoid extreme hunger, curb overeating, both of which can lead to bloating or indigestion and other gastric ailments. In general, scheduling what and when you eat will help you maintain a balanced diet and create a more stable energy source. A sample of the meal timing is shown in the diagram. Next, how to eat. So in this segment, I will not talk about the portion of food. Rather, I will speak on mindful eating. What is mindful eating? Be an exclusive eater. This is a time when multitasking is not encouraged at all. Don't watch TV, don't read a book, don't use your phone during meal times or snack time. You won't be able to pay attention to your food or your body if you're eating with distractions, and you may end up eating more than you need to. Next, eat slowly and mindfully. Put your fork down between bites, chew your food well, and make each meal last 20 minutes. Savor your food, noticing the texture, the taste, the shape, the feel, and flavor of each bite. Doing so will ultimately help you not only to enjoy meals more, but recognize you are satisfied enough to stop eating. Watch your hunger levels. Notice if you're eating because you're hungry or if other external cues are sending you towards food. Be sure to eat before you get too hungry to lessen the chances of making impulsive food choices. Lastly, address stress. Stress can make you turn to food even when you're not hungry. Recognize when you're anxious and address your stress in other ways. Try taking deep, relaxing breath or go for a short walk. In this segment, I will address the 3 most common popular diet, the keto, intermittent fasting, and also meal replacement diet. First is keto diet. So unlike other low-carb diets such as Atkins and Paleo diet, the keto diet is exceptionally high in fat and low in carbs with a moderate protein intake. You may appreciate that the nutrition distribution is very different from the healthy plate I had shared earlier on. Remember the quarter half. This keto diet consists 75% of fat, 20% of protein, and 5% of carbo. The 5% of carbo allowed in a keto diet is equivalent to just a small tub of yogurt, an apple, and half a medium potato over a day. Those on keto diet use high-fat food such as butter, coconut oil, cheese, peanut butter, fatty fish, and full-fat milk to control the hunger. And instead of lean meat, dieters may sometimes go for fattier cuts. What happens in keto diet? This diagram can be complex, but in simpler terms, what it means is traditional diet usually breaks down carbohydrates for energy. When the body can't draw energy from carbohydrates, or either because they have been cut out of the diet or because a person has not eaten for a long time, it looks for other forms of energy. In this case, fats are the next option. In a person undergoing a keto diet, he or she deliberately forces the body to break down fat and hence producing ketones. Over time, stored fats is being used up and weight loss can occur. Possible benefits of keto diet includes improved fullness from a meal. It has been shown in some research studies that low levels of ketone from keto diet are able to reduce hunger hormones level that we normally produce in between meals. This way, without the increase in hunger hormones levels, the diet is easier to maintain. Due to overall reduced intake of glucose and sugar, and also weight loss, blood glucose level and insulin sensitivity can both be improved. It's important to know that there are some risk involved with putting your body into ketosis. A common side effect includes bad breath, constipation, indigestion. In the first few days of the diet, you may also experience nausea, insomnia, and a general feeling of being unwell. Some people may turn to processed food as their main source of diet and end up consuming too much unhealthy fats. The high levels of unhealthy saturated fat combined with limited intake of nutrient-rich fruits, vegetables, and grains is a concern for long-term heart health. There will also be risk of low blood sugar levels if on insulin or medication. Next popular diet is intermittent fasting. It means either to have a certain strict way of eating on selected days or selected hours. Commonly will be the 5-2 method for those limiting the days, and 16-8 method for those limiting the hours. Generally, the methods of intermittent fasting does not describe the components of food taken. The 5-2 method. So this involves energy restriction to less than 25% of requirements for 2 non-consecutive days per week, while 5 days eat as per usual. So adults' daily requirements is roughly 1,005 to 1,008 calories per day. So 25% means is roughly 350 to 450 calories per day. Another approach is the time-restricted eating known as 16-8 method, which is very popular recently. Daily fasting of 16 hours and with 8 hours to eat. So an example will be eating only between 12 p.m. and 8 p.m. The possible benefits of intermittent fasting, research have shown that intermittent fasting have caused significant weight loss in short-term studies. However, it's important to note that it is not shown to be superior to a standard balanced reduced calories diet. It's also found to be linked to improvement in heart health and reducing diabetes risk. Through weight loss, reduce fasting glucose level and reduce insulin levels. These results are seen in the time-restricted form of intermittent fasting, where the timing of eating is in the day and late night eating is excluded. Possible downside of this diet includes increased hunger and overeating outside of fasting time. Possible side effects that might occur include fatigue, affected mood, feeling hangry, constipation, and fatigue. It also increased risk of low sugar levels if on insulin or medication in diabetic patients. What is a meal replacement? So a meal replacement diet is exactly what it sounds like. The idea is to replace your regular meals with low kilocalories, nutritionally complete powdered shakes and snack bars to reduce your overall energy intake and subsequently help you to lose weight. There are 2 types of meal replacement therapy. Partial replacement replaces 1 to 2 meals per day, while total replacement replaces all 3 meals with shakes or snack bars. Both are equally safe, except that the total replacement will induce mild ketosis and should be closely monitored by dietitian or doctor. Hence, important to note before you embark on meal replacement journey for weight loss. Talk to a healthcare professional for advice. So some take-home messages before I end off this talk. Our body requires balanced energy sources from carbohydrates, fats, and protein. Timing of meals are as important as quality or quantity of meals. Reducing portion or removing unhealthy snacks is a straightforward and easy way to start. Mindful eating is very important. Nutrition deficiency can occur, so speak to a dietitian. if you need further advice. And lastly, best diet plan is the one that is sustainable for long term. Thank you so much.